Have you ever wondered how important your oral health is during pregnancy? It's not something many of us think about, but let's dive in to see why it's essential. During pregnancy, your body goes through a myriad of changes. And yes, that includes your oral health. Hormonal fluctuations can lead to a condition known as pregnancy gingivitis, where your gums may become sore and even bleed. While this might sound a bit daunting, it's a common condition and there are ways to manage it. But why should you be concerned about it? Well, your oral health can directly impact your baby's future dental health. Your baby's teeth begin to develop between the third and 6 months of pregnancy, and your own oral health can play a pivotal role in this process. So, as you navigate this beautiful journey of motherhood, remember to give your oral health the attention it deserves. Remember, your oral health during pregnancy could have lasting effects on your baby's dental health. How should you take care of your teeth during pregnancy? This is a question that has crossed the minds of many, and today we're here to answer it. During pregnancy, your dental care routine should involve brushing your teeth twice a day with fluoride toothpaste. The fluoride in the toothpaste strengthens the tooth enamel, making it more resistant to decay. For that extra bit of cleanliness and to remove any pesky food particles that might have snuck into the spaces between your teeth. It's also recommended to floss daily. And don't forget about your regular dental checkups. These are crucial during pregnancy. When you visit your dentist, be sure to let them know that you're expecting. This way, they can tailor your treatment plan to your unique needs during this special period of your life. Now, some of you might be wondering about the safety of oral healthcare procedures during pregnancy. Rest assured, dental x-rays, pain medication, and local anesthesia, your dentist and healthcare provider will work together to ensure your treatment plan is safe for you and your baby. So what's the bottom line? Maintaining regular dental care during pregnancy is not only safe, but also highly recommended. It's all about ensuring a healthy smile for both you and your baby. Keeping up with these recommendations ensures a healthy smile for both you and your baby. So let's keep those smiles bright, shall we? What role does your diet play in your baby's dental health? Well, let's dive into that. A healthy diet is paramount during pregnancy, not just for your well-being, but also for your baby's. You see, your baby's teeth start to develop between the third and 6 months of pregnancy. So nourishing your body with vitamins and minerals during this period can support the development of your baby's teeth. But the responsibility doesn't end there. Once your little one arrives, it's essential to start oral care early, even in the first few days. Clean your baby's mouth with a clean, damp gauze or washcloth. This helps remove any residual milk or formula and keeps their mouth clean. Something to bear in mind, though, is the transmission of bacteria from you to your baby. Sharing spoons, cups, or even licking your baby's pacifier can transfer bacteria that lead to tooth decay. It's a simple thing, but avoiding these actions can significantly reduce the risk. Now let's talk about baby teeth. You might think they're going to fall out anyway, right? Well, yes, but that doesn't mean they don't need care. Baby teeth hold space for adult teeth, guiding them into the right position. So caring for these little placeholders is crucial. One common pitfall is baby bottle tooth decay. This can happen when a baby's teeth are frequently exposed to sugary liquids like milk, formula, fruit juice, or even sugar water. So try to avoid letting your baby fall asleep with a bottle in their mouth, as it can lead to prolonged exposure to the sweet liquids. Your baby's teeth are just as important as yours, and they need just as much care. Remember, establishing good oral health habits from the start can set your little one up for a lifetime of bright and healthy smiles. When should you expect your baby's first teeth to appear, and how can you ease their teething discomfort? Usually the first teeth emerge between 4 to 6 months, completing a full set of 20 by age 3. Teething can be eased by gentle methods, avoiding benzocaine-based gels before age 2, and brushing softly with a child-sized toothbrush. Remember to schedule the first dental visit by their first birthday. Stay tuned for future topics about flossing and using fluoride toothpaste for older children. Start your baby's dental care routine early for a healthy smile from the start.